Metformin. Brand names: Glyciphage, Glycomet, Fortamet, Glucophage, Glumetza, Riomet. Diabetes mellitus is a group of metabolic disorders in which the blood glucose is higher than normal levels. It is due to insufficiency of insulin release or improper response of cells to insulin. The resultant hyperglycemia produces the classical symptoms of polyuria, polydipsia and polyphagia, excessive urination, thirst and appetite. It may also cause nerve problems, kidney problems, and blindness, loss of limbs, and sexual dysfunction, increase in heart attack or stroke. Metformin, a biguanide derivative, by controlling blood glucose level decreases these complications. Metformin works by helping to restore the body's response to insulin. It is also used in women with polycystic ovarian syndrome. Metformin may make menstrual cycles more regular and increase fertility. Metformin was first synthesized and found to decrease the blood glucose level in the 1920s, however, it was not used for a long time. The use of metformin was rekindled in 1957, when the results of a clinical trial were published confirming its effect on diabetes. Metformin is now widely prescribed as an anti-diabetic drug, however, there have been serious concerns about its adverse effects, especially ketoacidosis. Recently, there are reports indicating that its adverse effects are negligible when its benefits are brought into account. Theoretically, its use has been prohibited in a large group of patients with type 2 diabetes mellitus due to the risk of lactic acidosis. However, it has been shown that several diabetic patients who are considered to be at risk have received metformin with no increased risk of lactic acidosis. Furthermore, recently some studies have been published indicating renoprotective properties for metformin. Metformin does not help patients who have insulin-dependent or type 1 diabetes. It is because they cannot produce insulin from their pancreas gland. Their blood glucose is best controlled by insulin injections. Where metformin is used to lower high blood glucose, sugar, levels in patients with non-insulin-dependent diabetes, type 2. For these patients the blood glucose levels cannot be adequately controlled by diet or exercise alone. Metformin may be used alone or in conjunction with other medications or insulin. How metformin works. Metformin decreases the liver's production of glucose, inhibits the breakdown of fatty acids used to produce glucose. It also increases the removal of glucose from muscle, liver and other body tissues. Dosage of metformin. Metformin is available as 500 mg and 850 mg tablets. Metformin alone, at first, 500 mg, mg, 2 times a day taken with the morning and evening meals or 850 mg a day taken with the morning meal. Doctor may increase your dose if needed until your blood sugar is controlled. Later, your doctor may prescribe 500 or 850 mg 2 to 3 times a day with meals. However, the dose is usually not more than 2,550 mg per day. Metformin should be taken with meals to help reduce stomach or bowel side effects that may occur during the first few weeks of treatment. Onset of action, within 2 hours. Duration of action, 12 to 15 hours. Dietary advice, to be taken along with meals. In case of missed dose. If you miss a dose of this medicine, take it as soon as possible. However, if it is almost time for your next dose, skip the missed dose and go back to your regular dosing schedule. Do not double doses. Storage of metformin. Store the medicine in a closed container at room temperature, away from heat, moisture, and direct light. Keep from freezing. Precautions. Because metformin is metabolized in the kidneys, extra caution is required in elderly patients with mild adrenal insufficiency. This condition is often detected by the usual tests for kidney impairment. Alcohol. Excessive consumption of alcohol may increase the effect of metformin, resulting in abnormally low blood glucose levels. Pregnancy. Metformin is not advised during pregnancy. Consult your doctor, if you become pregnant or plan to become pregnant. Insulin is usually the treatment recommended for pregnant diabetic women. Breastfeeding. Metformin passes into breast milk, although it has not been shown to cause harm to nursing infants. Consult your doctor for advice. Infants and children, not recommended for this age group. Do not take metformin if you have had an allergic reaction to it. Inform your doctor and he will prescribe suitable alternative. Overdose, symptoms of lactic acidosis or hypoglycemia. Seek emergency medical assistance right away. Drug interactions with metformin. Consult your doctor if you are under any other medication, especially if you are taking the following drugs: amiloride, calcium channel blockers, cimetidine, digoxin, furosemide, morphine, procainamide, quinidine, quinine, ranitidine, trimethoprim, triamterene or vancomycin. Disease interactions with metformin. Severe infections that could affect blood glucose levels. Conditions that could cause low blood oxygen levels like congestive heart failure or emphysema. Metabolic acidosis, buildup of acid in the blood. A history of alcohol abuse or kidney or liver disease. Side effects of metformin. Nausea, vomiting, stomach upset, diarrhea, weakness, or a metallic taste in the mouth may occur. If stomach symptoms return later, after taking the same dose for several days, tell your doctor right away. Lactic acidosis. Stomach symptoms that occur after the first days of your treatment may be signs of lactic acidosis. Remember that your doctor has prescribed this medication because he or she has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Metformin does not usually cause low blood sugar, hypoglycemia. Low blood sugar may occur if this drug is prescribed with other diabetes medications. Symptoms of low blood sugar include sudden sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. It is a good habit to carry glucose tablets or gel to treat low blood sugar. If you don't have these reliable forms of glucose, rapidly raise your blood sugar by eating a quick source of sugar such as table sugar, honey, or candy, or drink fruit juice or non-diet soda. Low blood sugar is more likely if you drink large amounts of alcohol, do unusually heavy exercise, or do not consume enough calories from food. To help prevent low blood sugar, eat meals on a regular schedule, and do not skip meals. Symptoms of high blood sugar, hyperglycemia, include thirst, increased urination, confusion, drowsiness, flushing, rapid breathing, and fruity breath odor. If these symptoms occur, tell your doctor right away. Your doctor may need to adjust your diabetes medications. Stop taking this medication and tell your doctor right away if this very serious side effect occurs: lactic acidosis. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any of the following symptoms of a serious allergic reaction: rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. Under certain conditions, too much metformin can cause lactic acidosis. Lactic acidosis is a form of metabolic acidosis that begins when a person overproduces or underutilizes lactic acid, and their body is not able to adjust to these changes. People with lactic acidosis have problems with their liver being able to remove excess acid from their body. The symptoms of lactic acidosis are severe and quick to appear, and usually occur when other health problems not related to the medicine are present. They are very severe, such as a heart attack or kidney failure. Symptoms of lactic acidosis include abdominal or stomach discomfort, decreased appetite, diarrhea, fast or shallow breathing, a general feeling of discomfort, severe muscle pain or cramping, and unusual sleepiness, tiredness, or weakness. If symptoms of lactic acidosis occur, you should get immediate emergency medical help. This medicine may cause some premenopausal women who do not have regular monthly periods to ovulate. This can increase the chance of pregnancy. If you are a woman of childbearing potential, you should discuss birth control options with your doctor.